Good afternoon, everyone. This is Dr. Jeff Gelblum coming to you live on Facebook Live, where we're going to do a potpourri of some of the common questions that I'm receiving at this time, January 2021, as relates to not only the prevention of COVID, but the care and treatment of COVID. And as all of you who have participated before on my Facebook Live events know, COVID is, in many respects, a neurological disorder. And what I mean by that is the clinical presenting features of this condition, which usually include loss of sense of smell, loss of sense of taste. These are neurological phenomena. So typically, we think of COVID as sore throat, fever, cough, achiness back here, respiratory difficulty. We tend to think of it as an upper respiratory syndrome, but in actuality, the way it presents is neurologic, and I can tell you in my practice, we are seeing a lot of the neurological manifestations of COVID. Now, typically these manifestations of loss of sense of smell and loss of sense of taste, those are the presenting features, and they clear up in time. But it's not unusual for these symptoms to persist. And that really reinforces the sense that the COVID virus, that tricky little devil, has a very good way of latching on to receptors that interface the nervous system with the exterior, the nasal passage, the taste passage. And with that, we can say that COVID in reality is very much a neurological condition. So what are some of the things that I'm seeing in my COVID patients on an acute basis and on a long haul basis? Well, acute basis means those folks who are just infected, who are having a little bit of a fever, cough, etc. What are the acute things? As I've just mentioned, loss of sense of taste, loss of sense of smell. These are the heralding features of a COVID attack. So if you have that, by definition, you probably have COVID. And then if it's subsequently symptomatized with fever, chill, cough, etc., then I can say without a doubt you have COVID. But we're seeing some long haul features of COVID as well. And by long haul, I mean those folks who have had COVID, recovered, no longer febrile, no longer coughing, no longer feverish, but still have some residual effects, neurological effects of the COVID. So what are the residual neurological effects that I'm seeing? Definitely loss of sense of taste, definitely loss of sense of smell, fatigue, because again, that speaks to the cerebral involvement of the virus. A lot of neuralgias, meaning nerve pain. Sometimes we see vertigo, which is a sense of room spinning sensation. And again, this is all very anatomically consistent with the neurological manifestation, because when you have vertigo, that's an attack of the 8th cranial nerve. Loss of sense of smell is the 1st cranial nerve. Loss of sense of taste is the 7th and 9th cranial nerves. You know from your old biology days that there are 12 cranial nerves. So certainly COVID hits that whole cranial elevator shaft from top to bottom, from cranial nerve 1 down to cranial nerve 12. So therefore, we know that this is a neurological condition and that patients do have residual neurological features. Sometimes these features can persist for several months. It has also been reported in the literature of a Parkinsonian-like illness, of a cognitive impairment, not a dementia, not like an Alzheimer's, but just cognitive problems, seizures, etc. So make no mistake, coronavirus is a neurological disorder. And the new variant of coronavirus that's striking the UK and winding its way through the US right now doesn't seem to be more severe, does not seem to be different in its attack on the nervous system or the respiratory pathway, but certainly tends to be more infectious. So that brings us up to the major point today, which is vaccination. I think it's imperative at this point in time that everyone be vaccinated. Now, as it stands now, vaccine is not FDA approved for youngsters, but clearly, if you are an adult over the age of 18, there is a need for vaccination. The older you are, the greater the need. If you have comorbidities such as hypertension, cancer, immunosuppression, diabetes, obesity, then clearly there is a need for that. So it is my recommendation that at this point in time, due to the overwhelming sense of disability that we're seeing associated with COVID, this is not your grandmother's bad flu. This is a distinct disease that has a whole syndrome of effects. As a neurologist in practice every day, we're seeing those neurological effects. As I've said, cognitive problems, memory problems, attention problems, difficulty with staying awake or having energy levels, nerve problems of neuralgias and tingling, myalgias, muscle aches. We're seeing problems with cranial nerve functioning, problems of persistent loss of sense of smell and taste, problems of vertigo, auditory disturbances. I've even seen a couple of patients with a seizure occurring on the basis as a remote long-haul effect of COVID. So it is a neurological disorder, and because of the significant morbidity, the prominent chronic problems that I'm seeing with it, I can tell you right off the bat, this is not your grandmother's flu, and as a result, vaccination is an imperative, and I'm recommending it for all of my adult patients. There even are some studies that are being conducted now to look at the effects of the vaccine on pregnant women. Again, that is a discussion that has to be had between you and your obstetrician. But for everyone else, it's COVID vaccination time, without a doubt. Now, one of the commonest questions I get is, well, if I had COVID, should I get vaccinated? And the answer is yes. First of all, if you had a very mild case of COVID, you may not have developed a robust enough immune response to ward off another COVID infection. Now, we know that there's another variant of COVID that is out there. That's why they basically shut down the UK. And we think that if your initial COVID attack was mild, meaning a couple days of sore throat, maybe a little loss of sense of smell and nothing else, that perhaps if you did have a very, very mild case, you may not have a robust enough response should you get hit with COVID again. So that is why it is recommended that even if you have had COVID before, you should get vaccinated. And I'm recommending this for all of my patients. So regardless of your prior COVID status, if you've had it, you get vaccinated. And of course, if you haven't had it, you definitely need to get vaccinated. So what's the story down here in Florida? Is the new strain here? Yes, the new strain is here in Florida. The new strain, you have to assume, is throughout the United States. I want to reassure you, however, that the new strain is not more virulent than the old strain. It's just more infectious. And all these riots that we saw in Washington, D.C., where you saw all those people attacking the Capitol without masks, obviously without social distancing, that's an ideal petri dish. That's an ideal scenario for a super spreader event. So because we're dealing with a new variant that is now working its way through the U.S., at this time, I really do have to recommend that everyone maintain good social distancing and continue to wear a mask. Now, even if you're vaccinated, you should still continue to wear a mask and social distance. Why is that? Because we know that the vaccine will prevent significant illness from COVID, but we don't really know if the vaccine can prevent transmission from COVID. And here's the point. When you get that vaccine in your shoulder, I've gotten it, my staff has gotten it, you get it injected right here, typically in the left shoulder, right in the deltoid. You'll get some achiness that night, and that's the sign that the immune response is kicking in. So you want that achiness. That's a very good sign. The next day, you might even have a little bit of a flu-like symptom. I didn't have that. Other people have reported that. But what that's telling us is that there's a localized inflammatory, beneficial immune response that is occurring right here. Now, that is a different scenario than if you get exposed to COVID, which is the typical way, through your nose or your mouth. Because when you get it exposed through your nose or your mouth, you're now generating immunoglobulins, antibodies in this area of the body, whereas the vaccine is generating that antibody response here and in the bloodstream. What that means is those folks who are vaccinated may not have an antibody population in the nasal passage and in the mouth to immediately deactivate the COVID. which means you could theoretically be exposed to COVID, cough on somebody, and give them COVID, even if you've been vaccinated and you have no illness whatsoever. So therefore, if you've been vaccinated, great. But we have to continue to maintain social distancing and masking because the vaccine may not provide the antibody population up here, which is the point of COVID virus attack and the point of COVID virus transmission. So that's why the vaccine data is not very clear about whether it can prevent infection of other people. So even if you've been vaccinated, you still do carry a risk of infecting others, and that's why everyone who's been vaccinated still wears a mask and still is social distancing. The good news in our office, I'm not wearing my mask now. I have it right here on the side, but because I'm with you and I'm locked in my back office, no need for it. But I can tell you out front in my office, we're all vaccinated, we're all masked, and we're all social distanced. And that's really how it should be when you're going into any closed environment. And I think that goes for restaurants, it goes for bars, it goes for shopping centers, it goes for anywhere that you're going to be in an indoor space. Now, obviously, if you're in a restaurant, you can't mask while you're eating, you can't mask while you're drinking. But when you're in a space indoors, whether you've been vaccinated or not, whether they've all been vaccinated or not, at this point in time, social distancing and masking are I think the norm and should be de rigueur, should be mandated by all business owners and all offices and any indoor space. And if they don't mandate it and if they don't request it, then I just would leave because it's just not worth the risk. If you are waiting for your vaccine and you are at high risk, please be extra cautious. The vaccine rollout is certainly less than optimal. We've all experienced that. The older folks in the nursing homes are the first ones in line. Us healthcare providers, fortunately, we've all received it, as have our staffs, but that changes from state to state. Luckily, down here in the Miami area, we've had very good access. The medical staff has had very good access to the vaccines. So I can tell you at the hospital where my office is, Aventura Hospital here in the north end of Miami, fortunately, the bulk of the clinical staff as well as the work staff, we've all been vaccinated. So that's all very important. And when you're going into a doctor's office, I think it's very appropriate to say, hey, has the doctor been vaccinated? Has the staff been vaccinated? Because I haven't been vaccinated, and I just want to make sure that I'm not going to give an illness to the doctor, or the staff is going to be in relatively good health. But I want to remind you, there's no guarantee that if you're vaccinated that you still can't transmit the virus. And that's because of what I said before. The vaccine is given intramuscularly here, but when you catch COVID, you catch it up here. So the immune response here is good and systemic, but it may not give you the same immune response of instantly deactivating the virus as it resides up here and as it may be transmissible to other folks. So that's why you really have to still keep your guard up. Masking, social distancing, definitely when you're outdoors in close proximity to other people, and if you are certainly doing anything indoors. One of the questions that we get is, well, I've just been vaccinated and now I'm okay and I don't have to worry at all. Well, that of course is not the case. Because if you've received the Pfizer or the Moderna vaccine, which at this point are the only two vaccines FDA approved in the United States, you have to remember it's a two-part shot. So the first shot of the Pfizer or the Moderna gives you approximately 54% protection. And that's good. But that 54% protection doesn't kick in till about 6 to 8 days after your initial shot. So you're going to have to be very careful during that time. And even after 8 days, you're still only 54% protected, which means you have to wait for your second shot in order to achieve the full 95% protection. And that second shot on the Pfizer side doesn't come till 4 weeks, and the second shot on the Moderna side doesn't come for 3 weeks. So what I tell everyone is, once you've been vaccinated, you've still got a good 5 weeks of keeping yourself very careful, of staying out of harm's way, making sure that you're social distancing, cutting down large family gatherings, and all of these other activities where you could potentially catch the virus. I know somebody that was vaccinated, and a week later they came down with COVID. Of course that's possible, because it takes 6 to 8 days for the vaccination to even cause any antibody response to occur. So therefore, within that first 5 weeks of vaccine time frame, it's imperative that you keep yourself safe, that you stay out of crowds, that you continue to social distance, and that you continue to mask. So one of the questions I get is, well, now that I'm vaccinated, let's go out and let's all party. Not so. First of all, as I've told you before, it takes about 5 weeks for the vaccine to kick in and give you that full 95% immunity that you get from the Pfizer or the Moderna product. And basically, there's no difference between the two. So whatever you can get, you take. And then, of course, during the early phase of that vaccination, you're still susceptible to the COVID because you don't have a full immune protection capability until you get the second shot. So it's wise to stay out of harm's way, away from indoor crowded spaces, and certainly social masking and distancing. One of the questions I also get is, well, gee, I had the first shot. I might have had a headache. I didn't feel good. Again, very, very rare side effects, because the side effects from the existing vaccines are extremely minimal right now. And do I need the second shot? Well, yes, you do need the second shot, because the first shot only gives you about 54% protection, and you need the second shot to get you up to 95% protection. So it is my recommendation that, of course, you go through with the 2 shots, because that's how the clinical trials were developed. And that's what I expect my patients and my colleagues to adhere to. So don't skip out on that second shot. And if there's a movement to say, oh, we've got to give more shots out to more people, so we're only going to avail you of 1 shot, don't buy that. Get the 2 shots. That's the way it's approved. It's kind of like eating shredded wheat without the milk. You can't do it, and it's not the way the product is designed. So 2 shots is the way you should go with Pfizer. 2 shots is the way you should go with Moderna. There's a J&J, Johnson & Johnson trial out there. It's a different type of vaccine, which may require only 1 shot. Great, but it's not available yet. And until it is, we're all living in a 2-shot world, and you take your pick of either the Pfizer or the Moderna product. And in that case, it's 50-50 in terms of, not 50-50, they're each good. So whatever you get is good. I can't tell you in my office each and every day how many people say, well, I'm not going to get the COVID vaccine because I'm scared of it. And my response is, well, sit in my waiting room and see people that have had seizures, see people that have been persistently ill, see people that aren't thinking right. Does that scare you? So anybody who says that, well, there hasn't been enough experience with the vaccine yet, I want to remind you that at this point in time, 9 million shots have been given. That's pretty darn good in terms of demonstrating a safety profile. I want to bring to your attention the case of a colleague of mine at Mount Sinai Hospital, an OBGYN, who developed an extraordinarily rare reaction whereby he had a drop in platelet counts, and unfortunately he passed away. Is that related to the vaccine? Probably. What's the incidence of that? Only 1 case has been reported. He's it. Unfortunately, we all know this case because we're in practice here in Miami, but I can tell you that is a 1 out of 9 million chance. For those of you who are watching right now, you have a higher risk of having your cell phone explode in your face and becoming permanently blinded than having a life-threatening risk from the COVID vaccine. So for those of you who say, well, what about that guy at Mount Sinai? What about the facial nerve palsies? This is all bullshit as it's being distributed on the internet. First of all, the incidence of facial nerve palsy in coronavirus vaccine recipients is exactly the same as in the general population. So if you look at those creepy pictures of the people with the droopy face that of course has been photoshopped to make it look like Uncle Fester from the Addams Family, I can tell you that this is nonsense, and the incidence of those types of scary side effects are the same incidence as in the general population of people who have not been vaccinated. So don't let anybody say, oh, it's too new and it hasn't been tested enough. I'm sorry, 9 million vaccinations, that's good enough for me. Typically, for a drug to get approved, they get approved with 1,000 or 2,000 in the cohort. And I can tell you, it's always been the rule of thumb that if you want to look at side effects in any new product, wait for 100,000 exposures. Well, right now we have 9 million exposures. So clearly, this new class of vaccine is a wonderful product, and as I've said previously, these new vaccines that are out, the Pfizer and the Moderna product, they only contain 10 ingredients. And the major ingredient is propylene glycol, which is what you used this morning if you took soap in your shower or shampoo. So the basic element in there that could potentially cause any type of allergic reaction would be propylene glycol, which is what you use to shampoo your hair every morning or wash yourself. So the side effect profile from these vaccines is minuscule, nothing of a significant life-threatening basis. And for those of you who are concerned about these things that you see on Facebook or other internet sources, I can tell you that the incidence is of no concern of mine. It is interesting to report. It shows up in the medical literature. It's definitely worthy of further research and investigation, but it's not anything that's going to prevent me from recommending vaccine to myself, my family, my staff, or anybody else. And it's certainly nothing that should dissuade you from getting a vaccine. So very, very great safety data. Again, 9 million doses out there, no significant side effects that we've seen so far. One of the questions I also get is, should the vaccine be mandated to everyone? I can tell you, in my practice, we mandate vaccination. I'm not going to give you any legal advice because I'm a neurologist, a doctor. I'm not an attorney. But I can tell you at this point in time in the United States of America, the Equal Employment Opportunity Commission has said that vaccination, if it creates a safe workspace, is useful and can be implemented and mandated to the work staff. We made that recommendation in our office. Thank heavens my staff didn't have to be forced into anything because we were all lined up over here at the hospital to get our shots first in line. But for those of you who are employers and are concerned about employees who may not wish to be vaccinated for whatever reason, I refer you to the Equal Employment Opportunity Commission here in the U.S., which says that you are within your rights as an employer to request that your employees be vaccinated. Now, if someone says, well, I have a health condition or I have this religious objection, obviously you have to try and accommodate, and you have to say, well, look, if you don't want to be vaccinated and you can work from home, terrific. But if there's no accommodation for having that employee work from home, then you can say, look, this is what we need to do to maintain a safe work environment. And if you're refusing or unwilling to be vaccinated, then you may have to consider employment elsewhere. I can tell you that at least here in the state of Florida, which is a right-to-work state, employer strength is very, very good in this regard, and you're backed up by the Equal Employment Opportunity Commission. So for all of you who are in business and were concerned about, employees, I would highly recommend that you have a discussion with your employees and say, look, we want to have a safe workspace. So therefore, we're going to recommend vaccination for everyone. And for those of you who aren't willing, we respect your opinion, but basically you're undermining the safety and security of the workspace. So that's the discussion that we had with our employees. Didn't even have to take it to another level because they all said, sign me up for the vaccination because we're so excited and we want to protect ourselves, our patients, our families, our friends, and all of that. So ask your legal counsel about mandating the vaccine. I think it's a good idea, and I think that anything that we can do to prevent workplace illness and keep our workspaces as safe as possible and as customer-friendly as possible, that's all a good thing. Of course, in the meantime, the workplace must be social, distanced, and masked because, as I said, the vaccine gives you good body immunity. We don't know what it's doing in terms of preventing viral transmission from the nose or the mouth. So there still is the opportunity for people who have received the vaccine to possibly transmit that that jury is still out. We don't quite know, but I'm not going to give you any recommendations in that regard because we just don't have enough data. So at this point, I'm still going to recommend social distancing and masking. So in summary, where we are right now is a very exciting time. I mean, this is the beginning of the end. We have vaccine that is being rolled out. Again, it's in fits and starts. It's not as ideal as one would hope, but it's still out there, and people are getting the vaccine. They are lined up. At least here in Florida, we've got many old folks who have already been vaccinated, and now they're starting in people over age 65, as well as those with cancer conditions and other high-risk scenarios. And the reason why I'm really here to you today is because if you wait in my waiting room, if you sit in my waiting room, you will observe people coming in with COVID-related neurological disturbances. Now, we treat that. And again, what we do is we treat the symptoms of all of this. But I'm here to you as a public service announcement to say all of that can be prevented if you get your vaccine. So for any of you who are concerned about potential side effects, I can tell you 9 million doses have been given. So far, it looks pretty good. Certainly safer than driving on I-95, emptying your garbage at night, or holding a cell phone, which can explode in your hand. That's got a greater incidence than 1 out of 9 million. So at this point in time, I'm going to recommend vaccination for everyone. I think that if you are pregnant, it's a discussion that should be had with your OBGYN. The vaccine is not currently recommended for youngsters, but the good news is youngsters typically don't get all that sick. Some of them can, but the vast majority do not. So with that being said, the vaccination is not yet indicated for people under age 16. But for all of us adults, I think it's a very worthwhile endeavor. It costs you nothing. It's paid for by your tax dollars. So take advantage of it and start to feel confident that you will be able to re-engage in the world. And when that moment comes, join me. I'm going to go to France in April, assuming that things are open and assuming that people are vaccinated over there. They've not done such a great job, but hopefully in the next few months they will. So on that note, I'm going to wish you a very good, vaccine-friendly and vaccine-filled Wednesday afternoon. And if you have any questions, always feel free to email me, jgelblum@fcneurology.net. It's always my honor and pleasure to try and give you some useful information. So get in line for that vaccine. Very, very important. Have a good afternoon, everyone. Bye-bye.